Hi everyone. My name's Lucy and I'm a dietitian working in Eastern Health across primarily our community and our inpatient settings. And I'm presenting some work I've been doing on understanding consumers' perspectives of food service systems in mental health inpatient units. I'd like to start, with an acknowledgement of country and an acknowledgement of lived experience. And so I guess where I was starting off is what we know and what we don't know. So in the hospital I work at and with a lot of other major hospitals, our current food service systems are designed for medical wards. They're designed for our consumers in physical health settings and may not meet the unique needs of our consumers. So our consumers are at an increased nutritional risk, but it's different than what we're used to seeing in our physical health wards. So maybe due to the side effects of their mental illness, so appetite changes, food refusal, disordered eating behaviours. Also, medication side effects is a massive one as well. Weight gain, metabolic changes, altered taste or appetite. And there is some research that has been done that's showing that in our mental health inpatient units, our consumers aren't actually meeting their nutritional needs. In this research showed weren't consistently meeting their energy or protein targets. The role of hospital food service system is to support nutrition as best we can. And guess what I was thinking about as a dietitian working, starting a new service in an inpatient unit, was I thought that a food service system was a really good opportunity to positively influence well-being by modelling and supporting healthy eating or modelling food behaviours. But that can only really be done when the systems are accessible and tailored to the needs of our consumers. So I guess that led to my key question was, how are the consumers perceiving food service systems and its role in supporting nutrition during their admission? So, my aim was to evaluate whether the current food service model was meeting the consumer's needs and seeing how they viewed its role in supporting their physical health whilst they were in hospital. So, I was wanting to engage key stakeholders, so the consumers themselves, food service staff, health professionals, also understanding the stakeholders' experiences of the system, and also wanting to inform future recommendations for service improvement. So basically, how I got my data was at about 6 months. Every time I had an interaction with someone on the ward, I asked them how they found the food service experience. And I kind of went over everything from about, how was it ordering meals? How is the dining environment? Just anything that encompassed what their experience with food was like in hospital. And not only did I do that with one-on-one sessions with consumers, we also have community groups and nutrition groups on the ward that I would get that information from. So basically, anytime someone saw me, I was asking the questions about how they found the food, which often got me some very interesting responses. So I guess I then completed a qualitative analysis and I got 6 key themes. So the 6 key themes were meal selection, food satisfaction, variety, dining environment, limitations in the food service systems, and provisional of additional food. The main one that I found was that overall the consumers were not being adequately supported to engage with the food service system. The number one thing I found is hospital menus are really confusing. They start with lunch and then end like it goes lunch, breakfast, dinner. Doesn't make a whole lot of sense. And they may not, for some of our consumers who are quite unwell, that can be really confusing to understand. Oh no, and hospital meals, they're bland and repetitive. They're designed for people who are in hospital who are physically unwell. The variety, I would say, especially, our hospital has a 28-day cycle, but even within that 28-day cycle of meals, there's a roast on every day. And it's like, you might get a roast and a pasta or a roast and a curry, and it can be really repetitive to get that twice a day for however long you're in hospital. The dining environment, some people found the dining environment really lovely, that was communal and people could, chat over a meal. Others find that really quite overwhelming and overstimulating. I had some consumers who would much prefer dining in their room, or they, even the idea, they didn't think they were allowed to, so they just missed a meal rather than going out to get their tray. Limitations in food service systems. Hospital food service have a really hard job. They've got to try and meet the nutritional needs for everyone who's come into hospital for a variety of different reasons. So, not only our medical needs for our diet, also our personal preferences. So it's a really hard job to try and cover all of that. And then finally, this is the provisional of additional food. So on our ward, we're lucky to have sandwiches, yogurts, fruits, things available on the ward, but sometimes that's just not enough. And especially if you do have, if you're vegan or vegetarian, that limits your options even further. So there was quite a high reliance on external food sources, so Uber Eats, DoorDash, family, and that puts an extra burden on the consumers and their families when if you look at, like, in Victoria, our food service standards say that we should be providing all of the nutrition that they need whilst they're in hospital. But people are having to rely on external sources because they're not meeting their needs whilst in hospital. So I guess I then kind of grouped things into about 3 different groups. So the first one was value, autonomy, choice, and behaviour modelling. So I think offering meal choice supports patient autonomy, which is a core principle in mental health recovery. I can think, as like a clinician, how much, when I would go and actually sit down and complete a menu with someone, the benefit that could have. And if someone hasn't been completing their menus for 4 days and finally they get a choice of a meal like that, I can't quantify what that does for someone, but I know it makes them feel a lot better. They're finally not having roast for dinner. They get to have like cannelloni or something, just offering them that choice. And a food service system, I think, is a really practical environment to help model and practice healthy food behaviour. So portion sizes, showing someone what a balanced plate can look like. On our ward, we're lucky, we have fruit available on the ward, so it's a really good opportunity for us to model and support those positive food behaviours whilst they're in hospital. Also, addressing the physical health gap. So variety and accommodating individual dietary preferences is critical for meeting diverse nutritional needs and mitigating physical health risks. Everyone is different, and so it's a really hard job to try and manage all that, but we have to try and do our best to manage all those things. Aligning food service with patient needs reinforces that physical health is integral to mental recovery, that one will not work, both need to work together. And then access and stability. So access to supplementary food addresses low appetite or increased needs. So if some people doesn't want a main meal, we can offer them a sandwich rather than them not missing a meal because they don't want to have the main. We have something else they can have. It also supports optimal nutrition to help model regular structured eating. I've had so many consumers who aren't eating well coming into hospital. Just the knowledge they've got breakfast, lunch, and dinner, and they know what time it's going to arrive, helps them really structure their eating and help model that behaviour. And then finally, so therapeutic environments and outcomes. So I think a flexible dining environment is really important, so it helps reduce stigma and encourage social engagement, which research does show that when you eat with other people, especially if you're at risk of not eating very well, improves oral intake and patient satisfaction. So just being able to share a meal with someone, that's why I love being a dietitian, that food's not just about the food that we put in, it's the social, it's everything about food. When we get to dine with other people, that really heightens that. And then client-centered design. So co-designing food service systems with consumers and using their feedback is crucial. This will improve therapeutic outcomes by consistently meeting the needs, basic physical health needs to support comprehensive recovery. So I guess my conclusion is that I identified 6 key themes, and the 3 things I pulled out of that was a tailored food service system can enhance satisfaction and support recovery. Co-designing this with consumers is essential to ensure responsiveness to diverse needs. And an improved food service system can promote both nutritional health and mental well-being. And where am I going to now? I've done a lot. I've now figured out. I joke this is like I opened a can of worms. I had to try and figure out where to go with it now. So I'm continuing to share findings with our key stakeholders and using it to guide future research and service improvements. The 2 things I'm really keen on, exploring how to increase menu completion. I think it's one of the easiest things we can do to increase satisfaction is make sure people are regularly selecting their meals, and the way they do that is being accessible. And how we model positive food environments, behaviours, and attitudes. Long term, we want to, we're doing menu audits and meal satisfaction to see if our interventions are working, with a longer term vision to enhance food quality and sustainability. And this work will align with the Equally Well framework and help move us toward maybe some tailored mental health food service recommendations like they have in New South Wales. They've got the nutrient gold standards, which actually provide tailored recommendations for mental health services. Yeah, that's what I've been working on.
Thank you, Lucy. I think it's 2 really interesting presentations around a different allied health service and the importance of thinking about food beyond just something to sustain us, but actually the importance in our lives food plays. Does anyone have any questions for Lucy?
Thank you. Thanks, Lucy. That's excellent work. How do the staff in the units come across? How do they accept the influence of the dietitian then to trying to create a healthy lifestyle for?
I would say
the
I've been really
consumers?
lucky that the units we've been working on, they've been so great of accepting our interventions. I think because they probably, before I started, we had no dietitian in our units. So they probably were, having someone there to help model that behaviour has been really well accepted. Yeah.
That's excellent.
Well, thank you, Lucy. That's great that you've got that perspective. I just want to put a plug in for something in Queensland that we've done recently, in Wide Bay and Harvey Bay. We've actually got an in-house chef in the acute unit who works with the dietitian, and people get to talk about what food they like and what they want to have, and the chef will make it for them. It sounds like a private hospital, which is, by the way, food in private hospitals are usually terrible, all right, because they think about cost, not about nutrition. So I just wonder if there's any flexibility, in what we do, because we're very locked into the hospital delivery hotbox service. And in fact, this service is not much more expensive and one hell of a lot better. And they said that the rate of incidence, the happiness in the unit, one of the most amazing things I've ever seen. So fantastic around actually responding to people's interest and desire to have good food. So fantastic. So thank you.
Food makes us really happy. Like, food is one of those fantastic joys in life. And I think it's, remiss that we don't get to acknowledge all that even when we're in hospital. Like, that's why I became a dietitian. I just love talking about food. It's my favourite thing. And I love being able to help, I joke, I think I've made up my job. That I get paid to talk about food every day. Like, it feels like a made up job.
Lucy, I just love the attitude of curiosity and approaching your work and thinking about it. I think it's a fantastic way to approach your work. But I was wondering if there's any ideas that have been zero cost that have come out of this work that you've been able to implement. Maybe not, but I just thought maybe some ideas that you've just been able to do straight away at zero cost that's made a difference.
The ideas have happened not because of me, but it's been really good timing. So at our organisation, we're actually changing our food service model, like the system we use, because it's actually going to allow us to use devices to order food. So we're getting rid of paper menus. And so there'll be a QR code that consumers can scan and actually pick their own meals. That wasn't me doing that. That's just really serendipitous timing. But I think, even just things that I can do is just when I'm on the wards, just, offering to assist with, offering to assist with menus, offering to, people got really specific dietary recommendations, like letting the kitchen know. So I mean, it's probably more what I've been able to do as a dietitian, just be that person on the ward for them to, if people have any concerns about their food, to be able to help them with that. But I'm really excited for people having their own device to order meals. That's going to be really, really helpful.
Yeah, thanks for the talk, Lucy. I'm glad, John, you mentioned it first, because I was thinking exactly the same thing. Like, I'm old enough to remember when hospitals had their own kitchens, food was all cooked on site, and staff would have the food that patients were having as well. I wonder whether or not we're just rediscovering that there is something more to food services exactly other than just the provision of nutrients.
Yeah, I've worked, so at Eastern Health we use a central production kitchen, but I've also worked at other services where it has been cooked on site, and you can definitely see a difference in the flexibility of the service and how they can respond to different people when we have those kitchens on site, or even just having a smaller kitchen that can provide additional things. Like I say, our ward, like, we can make toasties on the ward, and that is like game changing. Like, the fact that we can have toasty, even just the addition of toasties makes a world of difference.
Thanks, Lucy.
Thanks so much.
Really interesting.